Okay, welcome back everybody to V-Fest. Conversations with Kush podcast is out here live and we have a cannabis symposium going on. I am Molly the Kush RN, your host for today's show. I am joined by my dear friend LaTosia Erickson. She is a cannabis nurse. She is hoping to launch a beautiful retail business coming in fall, so make sure you get connected with her in some kind of way and stay attuned to the great things that she has going on. So welcome,
Thank
LaTosia.
you. Oh my gosh, I'm so hot. I'm always so nervous, but I know it's going to be fine. Yeah.
Tell us a little bit about who you are and what you do and how you came to cannabis.
Okay, so I'm LaTosia Erickson. I'm a registered nurse. I've been a nurse for a long time, over 20 years. Cannabis. So when I was growing up, cannabis was really taboo. Like weed, marijuana, it's going to make you crazy, whatever. That was how I was raised. But as a nurse working in the clinic, I noticed some years back, 5 or so years back, that some of the kids coming in were on cannabis, CBD. And I had to take a step back, like, isn't that marijuana? Like,
Yeah.
there must be something good in this herb if we're giving it to children, and children are really taking to it and having their having relief as treatment for like seizures and behaviors and things like that. So so that's kind of how it opened the door. I then found a program through Pacific. It's a little hard when she's
It's noisy out here.
Oh, so I then found a program through Pacific College, and they offer a certificate program for cannabis care nurse. By me being already in the healthcare profession, I could just take that course, and so that's what I did. And when I found out all of the wonderful things that cannabis can do besides just getting us high, I was hooked.
Yeah.
I wanted to know more, and I wanted to do more, and I wanted to educate other people about cannabis use for holistic wellness.
Right, and I always feel that nurses are like the absolute locking key to that piece,
Yeah.
right? We're born educators, we're trained as educators, we're caregivers. We want to look at the person from the whole, from their whole perspective. You know, their physical health, their mental health, their spiritual health, all the things. And then to add cannabis in there, it's just one more tool that we can utilize to help someone get to homeostasis.
Yeah, for
and
sure.
have wellness, optimal wellness.
Yeah,
right.
yeah, for sure.
So we are going to talk about the new user today.
Okay, all right.
Right.
So the new user, Sarah, I see. As a new user, I mean, the first things that we do, like as a cannabis care nurse, they have you to come in and really do an in-depth assessment, right? We have to start with what medications are you currently taking? What's your past history? What diagnoses do you have? What exactly are you looking to use cannabis for?
Achieve,
Do
right?
you really just want to get high, or do you want to use it for sleep, or do you want to use it for joint and pain relief? So so that's where we start. We do an it's okay. We do an in-depth assessment first, and then once we have that information, we make sure, you know, medication, there's not going to be any contraindications with that. And we start low and go slow and wean up. There's so many different ways that you can use cannabis. You can ingest it, you can smoke it. So some people like to inhale it. Some people like to, you can use it as an aerosol. You can sniff it in your nose. And with those measures, it starts to work about 5 to 15 minutes. You can feel the results of it. If you ingest it, so like if you have a cannabis drink or if you have an edible, then it's going to take a little bit longer because it has to filter through your liver. And so it just depends on how that person wants to take their cannabis. But the rule is you start low and you go slow because everyone's body is different. Like everybody has their metabolism goes differently. Everybody has different diagnoses in their body, so cannabis reacts to your specific body. I feel like that's the hard part with cannabis, though, is because
and the way you consume, like the type of product that you consume, will also affect people differently. So.
Exactly, yeah. And so it's not like a one-time thing. It's not like a one-size-fits-all. So you really have to be on your own cannabis journey. And part of the cannabis care nursing is we tell you that you need to keep a journal. Like, what exactly are you using? What type of product is it? Are you smoking it? Are you ingesting it? And how much of it are you using? And what are your benefits? Are your benefits outweighing the side effects? Because there are side effects. Side effects like, I'm too sleepy. I'm eating everything up. You know, or dizziness, or I'm getting paranoid. You know, those are all things. So you want to balance that. You want to take the good part of it and then not have negative side effects for it. Right.
So first thing you should always know is, what do you want to use cannabis for? Right.
Yes.
Second thing is, what are the different products or the different ways that you can consume cannabis? Right. Yeah. Some products will be high in THC. Some will be a mix of both.
Yeah, and then, so that's a good point. There's other cannabinoids that you can use for cannabis. It's not just about THC. It's not just about CBD. There are other cannabinoids like CBN that help with sleeping. There's other cannabinoids like CBC that help more with anxiety. And there are products that do have THC in them and products that don't have any THC in them. So yeah, it's really about what you're looking for.
So if you're a new consumer, it's not always about getting high. There's other things that we can use cannabis for.
Yeah, right? For sure.
So knowing what you want to do, knowing what products are out there, knowing how to consume, always going low and slow, keeping a journal are really key takeaways. Yeah. What about knowing if you have a good product? How do you know if you have a good quality product?
Okay, so I'm going to take one step back before we say that.
Thank you.
So also, you want to make sure that you know that when you actually smoke cannabis or inhale cannabis, it's going to happen right away. So 5 to 15 minutes. If you ingest cannabis, it's going to take at least 30 to 90 minutes. Don't go taking another gummy because you don't feel anything.
Right.
Don't do it.
Right.
Because then you're going to you're going to over-medicate yourself with the cannabis, and then you're either going to be in the couch or you're going to be paranoid.
And then you're in the emergency room.
That's right. And then you're going to have to wait until those effects go away. So, yes. So then next, how do you know what is a good product?
Let me just add one more thing onto that. And because we say this because we want people to have a good experience.
That's right.
We don't want you to be turned off from cannabis and be like, oh my gosh, no, I do not ever want to try cannabis again. So we're encouraging you to have a good experience with cannabis.
Yeah,
so go ahead, please.
For sure. So you need to make sure that you have the products that you are using, and this is the difference between legal cannabis and cannabis that you get off of the street. So legal cannabis, you will have a COA, a code of analysis. So on this package, I don't know which camera I'm looking at, but on this package, it tells you specifically, it tells you what products are in here. There's 5 milligrams of THC, there's 25 of CBD, there's 10 milligrams of CBN. And this is for sleep. This is a sleep one. But there's a COA right here. It tells you exactly what is in here. And there's also a barcode. Sometimes there's a barcode or a QR code on these that tell you exactly what you're purchasing. So you're not just out here, oh, I got this good weed, let me give you this, because you don't know what you're smoking. And if you have an intent, so if you're intentional about what you're using the cannabis for, then you need to know exactly what's in it to know that it's going to work for what you need it to work for. So that's, so this one is really good. I use this brand. This helps me to sleep. But also on this package, it tells you that one jelly can take 30 to 90 minutes. Sometimes packages don't tell you that. And you take it and you think it's like smoking, and it's not.
What are some other ways that when people are new to cannabis, they can ensure that they're having a good experience? What are some resources that they can go to help educate themselves on cannabis?
Oh boy, you're gonna ask me resources online.
How about Conversations with Kush podcast?
Okay, Conversations with Kush podcast. Yes,
That's a good one.
yes, that's a good one. And then I also like to use. There's an app and a website called Leafly.
Yep.
I use Leafly a lot, and it tells you specifically. It's more flower based, but it tells you specifically like what type of cannabis you're getting and what are the actual components in that cannabis that you're getting, what kind of cannabinoids, what kind of terpenes you might be getting, which is another part of the cannabis flower. And then I like All Bud too. That's a really good one for again for flower.
Yeah. So I'll just throw in a couple too. I really like cannakeys.com is wonderful. It's all evidence-based and research-based. You can look it up by cannabinoid. You can look up by condition. So whatever you're trying to treat, if you have like an autoimmune disease or something, it'll teach you kind of where to go for that. Also, healer.com is a really great resource for people. They also will give guidelines in dosing. So if you're brand new and you just need to know kind of where to start off with, they might do some dosing recommendations for you based on whatever you're trying to achieve with like pain, sleep, or anxiety. So just a couple more resources there.
Yeah, and there are apps too. There's apps that you can download for these things, and then there's apps that you can download and like hardback books that you can buy for your cannabis journey. That you can say like, this is what I tried today. This is the name of it. Jelly's Breath. Like I tried Jelly's Breath today, and it had this amount of THC in it, this amount of CBD in it, and this is how I felt on it. You know, like after the first puff. Oh, and let me just go in. Now, when you puff, you need to make sure that you're inhaling. Okay. Because if you do not inhale, you will not feel anything. Okay. So it's kind of like when you suck in through a straw, you want to make sure that when you're inhaling, that you are bringing it all the way into your lungs and you're letting it sit there for a little bit before you blow out, or else you're not going to feel the effects. Right. Because it has to come through into your lungs, get into your bloodstream in order to be effective.
Yeah. Do you think smoking is like, for me, I usually try to suggest like a consumable for people when they're first starting out, because I think that's a little bit easier to maneuver. Yeah. But there's definitely instances when smoking is the best route for people, right?
Right. Yeah. So I think it just depends on the person. I mean, like, 'cause sometimes when you go out here and you buy a gummy, it may be a 10 milligram gummy or it may be a 5 milligram gummy. You need to know how much THC is in it. And I would always encourage people, even if you feel like you want to take the whole gummy, start with half of it first. Start with half of it. And then again, wait. Wait for 30 minutes to 60 minutes and see if you feel anything, and then maybe try the other half.
Yeah. I think that is a really key piece for people that are brand new. It's just kind of journaling through it. How long did it take effect? How long did it take to take effect? How long did it last? How did I feel? Did it help my pain, or do I need to look at something different?
Right.
So, yeah.
Exactly.
And don't be afraid to try different things. There's plenty of products out here, or plenty of ways that you can consume, like using a topical. That's not going to cause euphoria, right?
Yes. Yeah. And there's also, I mean, like, I didn't even know this, but there are like topicals, the creams. There's tinctures that you can put under your tongue. And they say that they may work a little bit faster, but they do actually go into your system, so it's similar to when you are ingesting. There's also transdermal patches for CBD. I mean, it's really...
There's a product out there for you.
There's a product out there for you to help you with what you would like.
One last thing I want to cover with you, and I think this is really important, is conversations with your healthcare provider, right?
Yes.
How do we navigate these?
Honesty is
How do we
the
navigate
best policy.
Okay.
I feel like, and you know what, and that's key too, when we're doing the initial assessment as a cannabis care nurse, you do need to talk about any substance abuse in the past. And it's not just cannabis, any type of substance that you may have abused in the past, and what your history is with cannabis. Right. But yes, encourage you to definitely speak to your providers and be honest with them about what you're taking, because the cannabis that you're taking or not taking could be interacting with other medication that you're taking.
Right.
So you could go to drugs.com is a good resource for that to see if it would interact. But definitely, you need to be, your healthcare provider is there to help you. Right. And if that healthcare provider is you're not able to be honest with them, then you need a different healthcare provider.
Yeah, for sure.
Yeah.
I think it's important to remember the lexicon that we're using when we talk about cannabis too. So if you are scared to approach your doctor and tell them, hey, I'm using cannabis, make sure that you're using the word cannabis and that you're not saying weed or you're not saying marijuana, because those words do matter, and you want them to take you seriously, and you want them to see cannabis as medicine.
That's
and
right.
if those are the words that you have in the moment, that's great. But always try to bring it back to letting your provider know, like, this is the thing that works for me.
Yep.
And if they don't know much about it, then encourage them to find out more about it. You are their patient, okay? It is now their responsibility to know and understand cannabis and how it's working for you and how that can fit into your healthcare journey, right?
Right, yeah, exactly. So yeah, that brings me to, so how I came to these gummies is like I've taken this company, I've known this company, they've been open for 6 years, and they do Delta 9, which is Delta 9. I'm not even gonna go into that whole thing, but it's Delta 9. But how I came upon these is I had surgery. I had surgery last month. And of course, you know, they give you, I was doing extra strength Tylenol, and they gave me Narco, right? And so, but I couldn't sleep. I couldn't sleep for more than 4 hours at a time. My body needed to heal.
Sure.
So I go in, I talk to this holistic wellness person at CBD Midwest, and he said, okay, this is what I got. He was like, I think this could help you. And 2 gummies, it's a wrap. I sleep for 8 hours. And I didn't need the narco, you know, like I didn't need those big meds. I still have that prescription, but it's like, this is what worked for me.
Right.
You know,
so sometimes pain can be like a byproduct of other things going on. If we're not getting good rest, or if we have inflammation, or, you know, it can be a byproduct of those things. So if we can get to the source, we talked about this with Jackie earlier. If we can cure, or if we can satisfy what our endocannabinoid system needs, then all the other systems will be okay.
That's right.
So
that's right. Yeah. So it was really helpful, and and I'm an advocate. I was not a fan before, but I'm a fan now. And I'm out here. I'm just trying to educate people. I'm trying to decrease the stigma. And when I open my business, I'm an open book. You can ask me whatever questions that you want to ask me. I have an Instagram at Flower Power and Wellness. It's AND Flower Power and Wellness. Or I have email too, flowerpowerandwellness@gmail. So if you want to reach out or anything, I'm around.
Here you are, folks, a trusted resource right in our community. So tap into LaTosia and what she's doing. If there was one thing that you could tell a new consumer, what would that be?
Know your product and start low and go slow.
There you go. You heard it first. Conversations with Kush, live at V-Fest. Thank you again, LaTosia.
Yeah, thank you for having me.
Peace, everybody.